My name is Megan Keith. For my reproductive system portfolio, I decided to focus on the clinical case study on ectopic pregnancies. In a typical pregnancy, fertilization takes place in a fallopian tube that links the ovary to the uterus. The fertilized egg then travels down the fallopian tube and implants in the uterus, where the embryo starts growing. Ectopic pregnancy occurs when fertilization and implantation happens outside of the oviduct. This is a life-threatening condition and one that does not support growth of the embryo into fetal life. How can fertilization occur outside the oviduct? Most ectopic pregnancies occur when implantation happens in the fallopian tube. This type of ectopic pregnancy is called a tubal pregnancy. Tubal pregnancy typically happens when the fertilized egg isn't able to move down the fallopian tube fast enough. An infection or inflammation in the tube may cause this because the tube may become partially or completely blocked. Things that can increase risk for ectopic pregnancy include fertility drugs, in vitro fertilization treatments, pelvic surgeries, sexually transmitted infections, pregnancy in females over the age of 35, and smoking and drug use. Not only are ectopic pregnancies not able to support embryo to fetal life, they are also extremely dangerous and life-threatening to the mother. This is because fallopian tubes can break if stretched too much by the growing pregnancy. This is called a ruptured ectopic pregnancy. Less severe effects of ruptured ectopic pregnancies include pain in the back, shoulder, and abdomen, dizziness, and fainting. But also, more seriously, ectopic pregnancy can cause internal bleeding, infection, and in some cases that leads to death. In some cases, hormonal imbalances or abnormal hormonal levels can be a cause of ectopic pregnancies, but you can also experience some hormonal complications during an ectopic pregnancy, including low levels of HCG, progesterone, and estradiol. This can make early detection of pregnancy based on symptoms less common in patients with ectopic pregnancies compared to normal, and low levels or even high levels of HCG can increase the risk of rupture of ectopic pregnancies, making it a lot more dangerous. There are multiple methods for treating an ectopic pregnancy, and they're usually based around the complications and the symptoms that the mother is experiencing during the ectopic pregnancy. If it's an early ectopic pregnancy and there's no unstable bleeding, it's usually treated using a medication called methotrexate. Methotrexate stops cell growth and dissolves the existing cells to terminate the ectopic pregnancy, and this medication is given via an injection. In other situations, laparoscopic procedures are done where a small incision is made in the abdomen, near, or in the navel to either remove the ectopic pregnancy alone or both the ectopic pregnancy and the fallopian tube, and this is using a small tube with a camera attached. In some scenarios, emergency surgery is necessary, and this typically involves the removal of the ectopic pregnancy and the fallopian tube, because in these emergencies, it's typical that rupture has occurred. There aren't too many severe consequences of treatment for ectopic pregnancies. With methotrexate, some patients report some abdominal pain, vaginal bleeding or spotting, nausea, vomiting, diarrhea, and dizziness, which I wouldn't consider too severe. And with the procedures, such as the laparoscopic procedures and emergency surgeries, patients reported pretty similar effects and consequences as those did with the methotrexate, but there's always that added risk of infection when making an incision and going inside of the body.